Good afternoon. I'm Jill Valley. Montana Governor Steve Bullock is holding a news conference right now to provide some details on how the state's going to support destination communities to make sure they have the resources they need to enter Phase 2 that starts on June 1st. He wants to make sure we have all the resources we need to welcome visitors back to Montana again. Let's go now to Helena.
Today, helping our neighbors looks like staying home if you have symptoms, washing your hands frequently and thoroughly, and wearing a cloth mask at grocery stores or other public places where social distancing isn't possible. It means sitting at least 6 feet away from your neighbor to have that beer instead of sharing it at your patio table. And because Montanans are neighborly, many of us have been doing all of these things and more. Your efforts have flattened the curve in Montana so that we could reopen. And it's crucial that you continue those efforts so that we can stay open. As we reopen Montana, I also ask that you listen to businesses. They will look and function differently as they institute social distancing and sanitation measures for their and for your safety. Right now, supporting local businesses is more than just giving them your patronage. It's respecting the decisions they make to protect themselves, their employees, and the public. I know that this new normal is a big change, and I know that it's hard to continue. But Montanans and their precautions have made us a state with one of the lowest rates of COVID-19 in the nation, and we must remain fully committed to social distancing. We have to keep at it for the sake of the people and for the sake of the state that we love. As we move into Phase 2, starting this coming Monday, June 1st, we are asking the same of our visitors as we do of Montanans. If you're going to come to our state, heed state and local restrictions, as well as the guidelines set up by businesses. Engage in the same precautions we do and exercise patience as tourism communities slowly and gradually welcome you back. We are working with local communities and local public health in our travel destination and gateway communities to make sure that they have the resources that they need. As an initial matter, we utilize Department of Commerce data to analyze typical visitor travel in our state over the period from June to September. And we looked at the top destination counties, and those counties experience high levels of destinations per resident. We've identified the top 20 counties, those having about or more than 2,500 visitors during this time period for that initial outreach that we've been conducting. Communities range from Gallatin, Park, Yellowstone, Missoula, and Flathead to counties like Dawson, Carbon, Madison, and Richland. However, this list isn't exclusive, and other counties can be eligible based on identified needs. This will be an ongoing process as we slowly and gradually begin to welcome visitors back to our state. And as we see what the type of demand communities and businesses are seeing to ensure a safe path forward. We're asking of our businesses and destination and gateway communities that they partner with us and with local public health in educating visiting guests on destination safety and how to avoid risks. We're also asking those businesses to take the necessary precautions in protecting their employees. Everything from implementing symptom screenings to posting signage to remind staff, vendors, and customers of safety measures to proper cleaning and disinfecting. We recognize that we're asking a lot of our businesses and local public health, particularly in tourism communities. Therefore, we've identified particular ways to support these communities that will see travelers. The state is and will continue to be a partner in ensuring that we can all move forward together while protecting our residents. Over the past several weeks, we've been increasing testing of key populations in the state to develop early warning signs for possible COVID-19 risks. That began with nursing homes in tribal nations. We're working with local county public health in communities with popular destinations during the summer months also to implement community snapshot testing. We have a contract in place with community health centers across our state, and we're working with emergency rooms and other providers to take regular community snapshots through that testing. We'll be working with our state lab and reference lab contracts to increase our capacity for community and population testing of not just symptomatic individuals, but also those individuals without symptoms. This partnership will help to serve the destination and gateway communities in addition to other communities across the state. Part of our objective is to begin to test more and more of our population regularly, including those who interact with visitors, to help develop an early warning system and keep businesses open over the long haul. This includes healthcare workers, but also those at places of work who will see increased visitation, including grocery stores and restaurants. For individuals and businesses who participate in this testing, it's always important, though, to note that those results only capture that one snapshot in time. But as we focus these tests on frontline workers, we'll be able to more quickly trigger our early warning systems, identify positive cases, isolate, and keep Montanans and Montana communities safe. Additionally, as our local public health departments have been equipped all along the way to accommodate comprehensive contact tracing, ensuring that if there is a new case, that person gets isolated and those possible contacts quarantined, we're also going to make sure that that remains the case. To date, 96 local public health offices have requested over $4 million in funding from grants to help boost these efforts. We're also here to support the development of contingency plans for managing sick visitors, especially in highly traveled areas. And we stand ready to provide enhanced contact tracing support at the request of local authorities. This morning, General Quinn, my Adjutant General, directed all National Guard members who are currently on Title 32 orders to take the online contact tracing course and to obtain that certificate. This will make an additional 150 contact tracers available if needed. Today, I'm also announcing 2 additional measures to support our destination communities, as well as other small businesses across our state. Beginning on Monday at covidrelief.mt.gov, at that website, a new grant program will be available for destination and non-destination businesses across the state. The Montana Business Adaptation Grant Program will provide reimbursement for COVID-19 expenses related to keeping staff and businesses safe. Expenses include things like the purchase of personal protective equipment, installation of sneeze guards, hand sanitizer, resources for remote work equipment, cleaning supplies, and more. Total funding available is $20 million, and businesses can receive up to $5,000 in reimbursement. Additionally, as Montana begins to welcome visitors back into the state, it's more important than ever that visitors are informed and educated about the public health and safety protocols that we have here in Montana. When I first announced that we'd be entering phase 2, I discussed that the state would be developing an informational campaign for responsible travel, focusing on knowing local guidelines for restrictions before visiting, staying home if you're sick, and understanding services and destinations for visitors may be limited as we continue our phased approach to reopening Montana. The state will make available $15 million in CARES Act funding to carry out this important work, to inform and educate visitors before they arrive and also once they're here. The Department of Commerce in coordination with the Department of Public Health and Human Services, is leading this effort. I've asked that they work with local tourism partners to create and deliver this coordinated message to visitors at the right time and in the right places. In addition to launching a statewide informational campaign, we have also and will continue to work closely with certain communities most directly impacted by visitation to Yellowstone National Park. That's within Gallatin and Park counties. Yesterday, I sent a letter to Yellowstone Superintendent Cam Shawley requesting that the park reopen access to and from the park visitors, from the park to visitors at the Cook City, Gardner, and West Yellowstone gates effective June 1st. I've appreciated the park's coordination and consultation regarding the plan to reopen, including efforts to engage local public health in the counties surrounding the park. I've also appreciated the superintendent's recognition that a simultaneous reopening of the park's 5 gates on May 18th would have been difficult to manage and allowed for additional time to make sure that appropriate safety measures are put in place. I do feel that the park has worked to address the concerns we initially identified over tours in highly trafficked areas. Tour operators are capped at 10 inclusive of employees, and COVID operation plans must be in place and reviewed by the Public Health Office at the Department of the Interior prior to operations. Parks also invested in signage, boardwalk configurations, cleaning systems, plexiglass, and other measures to address needs for protection and social distancing for staff and visitors. Parks also improved their contingency planning for managing sick visitors and employees, ensuring that we have good protocols in place should they need to be transported for hospitalization or additional care beyond the park's medical clinics. Perhaps most significantly, with additional test kits that were provided by Montana, Yellowstone National Park is conducting asymptomatic surveillance testing, which will begin today to initially test workers with high visitor contact. This testing will be coordinated with the early efforts in Park County already underway and with gateway businesses and others over time. We'll continue to ensure that we remain in close coordination with the park and the surrounding communities to create an effective early warning system that can serve to protect workers and visitors alike inside and outside the park. Additionally, Glacier National Park Superintendent Jeff Mao continues to work with my office, with our Chief Medical Officer, Dr. Holzman, and county, federal, and tribal officials to anticipate COVID-19 impacts on gateway communities when Glacier National Park reopens. Glacier National Park officials are working with local communities to put in protocols, put them in place for managing possible sick visitors and employees, testing sites located adjacent to the park, a surveillance monitoring program of asymptomatic staff working in the park, and COVID-19 signage and information throughout the park. After discussions with Superintendent Mao, I believe we're going to target the second week of June for a phased reopening of Glacier. The specific date, though, has not yet been determined. During this initial phase of reopening, Glacier National Park plans to provide access to the Camas and the West Glacier entrances of the park. The Going to the Sun Road will be open to vehicles as far as Avalanche, with hiker-biker access provided beyond Avalanche. Restrooms will be available throughout the park, and private businesses in Apgar Village may be open. The park continues to plow the Going to the Sun Road, and the entire road is expected to open in late June as normal. Entrances on the east side of the park from the Blackfeet Reservation are expected to remain closed till the Blackfeet Tribal Council lifts the prohibition on non-essential travel. Superintendent Mao and I will continue to work closely with the Blackfeet Nation and the Business Council on any decisions regarding the eastern gates. At the end of the day, we know that this virus doesn't know jurisdictions. Making sure that everyone who wants a test can get one is a fundamental part of our approach in moving forward with reopening. And this is something we're working towards every day in alignment with our testing target of eventually conducting 60,000 tests a month. The state, National Guard, tribal nations, IHS, and other partners have been working in coordination to set up drive-through testing on Montana's reservations. Over the past couple of weeks, I've worked to stand up and visited the drive-through testing on the Fort Belknap, Blackfeet, and Crow nations, where everyone's working together with really the same goal, to make sure that we mitigate and contain any additional cases and give people the comfort of being able to get tested. And the sooner that we find positive cases, the better off we are. Yesterday, we ran about almost 600 cases in the Crow Nation, or in Bighorn County, and 3 new cases were identified in Bighorn County through that drive-through community testing. This is the exact purpose of why we're standing up this testing in tribal communities and expanding across the state. By identifying positive cases quickly, we can reduce the chain of transmission. And of course, if anyone even has one symptom of COVID-19, we're encouraging them to get tested and the providers to do the testing. Of our 73 nursing homes in Montana, 52 of them have received supplies so far. Almost half of them have testing underway. 8 have completed testing with no positive cases. And we also certainly want to get to the point where we have drive-through testing or other testing mechanisms for all frontline workers. Everyone from healthcare workers and to grocery store employees, and also for any Montanan that would like to be tested. Because the sooner that we can find those positive cases, the better off that we are. We've increased our testing by 100% from 2 weeks ago. Week of May, we've performed 3,279 tests. Week of May 16th, we performed 6,562 tests. While we're increasing our testing capacity and cases remain low, though, it's important that Montanans recognize that we're not out of the woods, and we won't be until we see a vaccine. And it's the actions that we took as Montanans initially that got us to where we are. It's not by chance that we have the lowest number of positives per capita. Especially as we head into the summer months, I again remind Montanans that as we create a new normal, our success in continuing to combat this virus, it's really dependent upon all of our actions. I'll now open it up for questions. If you'd like to ask a question, you can press 5*. You'll be notified that your hand is raised. When we unmute your phone, you'll be notified that you've been called on to ask your question. First phone question.
Hi, Governor Bullock. This is Jonathan Hager from Montana Free Press. I was just wondering, you called this stuff an early warning sign or early warning system for surveillance testing in the gateway communities around the park. What happens when you find out that the virus is there? Would that eventually mean that the park's gates are closed again, or just kind of help alert local health officials?
Well, I think it helps inform the state and local health officials of what the virus is doing. And that's, the more earlier that, as we see positive cases, certainly, first of all, that means you can isolate that individual immediately. You can do the contact tracing, you can quarantine others and test others as well. But we look at this, and it's more, it's a surveillance testing, but it's to provide local communities that early warning that we might have a positive case in our midst. Of course, we have our plans and ideas, and the virus hopefully doesn't have plans separate and apart from that, meaning that certainly we'll have to monitor in all of our gateway and tourism dependent communities what's happening to them along the way. But it really is sort of the warning system and trying to get the testing out there and ensuring that frontline workers have that will be the best way that we can limit the spread of COVID-19 in our state.
Hi, this is Karen from the Bozeman Daily Chronicle. I was hoping you could explain what the difference between the community snapshot testing for destination communities is and the surveillance testing that you guys have been doing in other places, and who exactly in destination communities would be the focus of this testing.
So, and it may just be a matter of words. So surveillance testing can be any number of things, right? That you want to take at least a percentage of individuals that are tribal nation, or as we're going to first try to test through everyone in our long-term care facilities as well as the workers. That provides a snapshot, but then as surveillance and continuing testing would be both symptomatic and asymptomatic folks along the way. As we look at our gateway and tourism communities, one of the things we really want to emphasize is individuals that have frequent contact with visitors and others alike. So that would be many individuals, of course, in sort of either hospitality or the direct tourism industry. Because while we may not be testing every tourist, the more that we can actually test sort of those frontline workers, that's when we'll know if positives occur. So, and we're working with, and will be working with both the local communities and the public health as far as what works best for them. Next question, please.
Good afternoon, Governor. This is Chris Peterson from Real News. The Blackfeet in the east side of Glacier Park, I understand the Blackfeet were supposed to kind of make a decision today or tomorrow as far as the travel restrictions. If they make a decision, then does the east side of the park like open immediately, or is that going to be phase 2? Do you have any idea?
You know, at this point, what we're going to do, I mean, we'll be in contact with Superintendent Mao, but I don't think any of those decisions have necessarily been made. Next question, please.
Hello, Governor. This is Nikki Willett from Yellowstone Public Radio. Thanks so much for holding this press avail today.
Thank you, Nikki.
I'm curious. Thank you. With expanded testing in tourism destinations, how will visitor tests and results be tracked in the state dashboard? And you've mentioned this kind of throughout your remarks, but I'd like a condensed version for radio. When you say that the state is supporting tourism destinations, can you give me some examples of what that would look like on the ground?
Yes. So the state is working with local health in supporting tourist destinations, and that's not just, it's both the businesses and public health to ensure that we have testing capabilities in place that go beyond just those with asymptomatic or symptomatic, ensuring that at the end of the day that many of our frontline workers also can be tested. But it's also the education pieces, and our Department of Commerce and Department of Public Health are working closely with both local tourism to put together an advertising awareness of what we expect of tourists in Montana. And what was your first question, Nikki? I was trying to be concise in the second half.
You did great, thank you. So when visitors get tested as part of the expanded surveillance and sentinel testing in those tourism hotspots, how will the visitors' tests and results be tracked in the state's dashboard?
It will be like if the test is run in, let's say, Carbon County as an example, that still anticipate that we will report that out as a test in Carbon County. When you have positive, that's where it gets a little bit confusing, but we'll figure out the ways so that Montanans know it. I say it gets confusing because, well, it seems like a lifetime ago, our first positive case was actually someone in Maryland who hadn't been in Montana for, I think it was like 9 months, but since they were a Montana resident, that was deemed as Montana's first positive case. Long way to go. So when we're testing, and what we've set up with Yellowstone National Park as an example, we're getting information about both where they live and also where they're staying. And we'll report out the tests through whatever county it might be, and I'll make sure that we have accommodations made if it's an out-of-stater that was tested positive in Montana. As we go into phase 2, we'll figure out a way to be able to report that to you all. Next question, please.
Governor, this is Tristan Scott at the Flathead Beacon. Thanks for the opportunity. I think the one thing I'm hearing from these gateway communities is that they anticipate the challenges they're facing to be exacerbated with parks like Glacier and Yellowstone opening, at least initially due to the lack of food and lodging services within the park. I'm just wondering how soon things like dedicated testing centers and quarantine facilities will be available in these gateway communities, and also with whom is the state coordinating on making these available? Are you coordinating with federal agencies? I'm just kind of curious.
Yeah, so Tristan, it's no exaggeration to say even today that our staff is in contact with Hillary Hansen, who's the public health official, that runs public health in Flathead County. So we're working with them as well as healthcare as far as what the best things to set up on the ground are, because it is sort of both local public health and the businesses that will be driving that along the way. That the same happened in Yellowstone, as an example, worked with Gallatin County as they looked at possible places for quarantine and other things. So and then we're also, both at the state level and then local public health, we'll be working with both businesses and business organizations. We'll be providing businesses some information as well. Next phone question.
Hi, Governor Bullock. This is Marisa Giorgio with NBC Montana. A lot of these tourism businesses in Montana hire seasonal employees, many from out of state, some international. Are you concerned about a labor shortage here for some of these businesses if we have a sudden of visitors, as some are anticipating, and they don't have the people here in the state to work?
Yeah, Marisa, I think for a lot of these businesses, having a labor shortage at this point would be a nice thing to have, meaning that many of them have been shut down and had challenges throughout this. Even with a phased reopening, we don't anticipate that, certainly for a lot of our hospitality industry, where we're still at only 70%, but I think that it's something that certainly our both businesses and Department of Labor will be looking at. And I think that at the end of the day, we've even seen through phase 1, there were some businesses that chose not to open at the time. And every individual business has to be responsible, and how can it protect both its employees and customers along the way, and abide by the state and local directives. And then how can they ensure that they have the workforce that they need to do so safely? Last phone question.
Hi, Governor Bullock. It's Kristen from Davis Chronicle again. I was hoping you could talk a little bit about, you said the state would be assisting local public health departments with contact tracing and providing other resources to kind of develop plans for the opening of the park. Would those resources include funding in any capacity, or what might those resources look like? So
there are a couple different things. And one, our state medical officer has been in regular and consistent contact with Matt Kelly, your public health officer, as well. funding. There has been a round of grants that have already gone out as relates to direct funding. The partnership of, I think if Gallatin County decides that they need additional resources put into COVID-19 and into the local public health department. I mean, we're right now working with the Montana Association of County Organizations and the League of Cities and Towns to reimburse their COVID-19 related costs. And then it also becomes if what a county or community needs is bodies, meaning contact tracers. Not only do we have the 100 and some of the National Guard soldiers and airmen available, but we also have people at the Department of Public Health and Human Services available as well. So as to directly to your examples, like Gallatin County has looked at what they think they need in the gateway communities, been in regular contact with both my staff and our state medical officer. Anything else? Great, thank you all so much again for your continued diligence. It's going to be, at least in this part of the state, a very nice weekend. Get out and enjoy yourself, of course, but also continue to recognize that the actions that we take individually and collectively are the actions that are going to help shape what Montana looks like going forward throughout the summer. So thanks so much.
All right, you were just listening to the governor talk about how Montana is going to respond as we head into phase 2 starting June 1st and as we start to welcome our out-of-state tourists to our state for the summer season. The big news is they're looking at the second week of June for a reopening of Glacier Park, at least on the west side right now. Exactly what that looks like, they're still working on, and the exact date is still being determined. But there is some hope there, kind of a little bit behind where Yellowstone Park is right now as far as opening, but they're coming up with a plan. They're actually working on a $15 million campaign to send around the nation to let people know how to come to Montana and how to be safe when you're here and what will happen if you get sick. There's going to be more resources for those counties in Montana that take the brunt of our tourists. They identified the top 20 counties that have a lot of out-of-state visitors. They want to make sure there's plenty of testing for those in the tourism industry who work with people, and they want to make sure that there's a place for visitors to go should they come down with COVID-19 so they can be cared for here. They're really going to keep an eye on these areas that get a lot of tourists to make sure that people are staying healthy and staying safe. In fact, the National Guard now, all of the members will be taking a course in contact tracing, so they'll be certified to do that. He also mentioned that there's a $20 million grant called the Business Adaptation Grant. So if you're a business who had to spend a lot of money putting up the plexiglass sneeze guards and had to spend a lot of money on disinfectant or stickers on the floor to keep people socially distant, there is grant money available to help recoup some of those costs. $5,000 is the max for each business, but go to the state website for covid19.mt and you can get some details on that. Basically, we're just kind of coming up with a plan and a way to make sure that when we do start seeing people come back to the state, they stay healthy, we stay healthy, and we'll be okay there. He also did mention this, that when we support our local businesses, we do it with our money, but we also do it with our respect. So if you have a business that's asking you to wear a mask or that wants you to be 6 feet apart, respect them enough to understand they are doing what they need to do to keep their business solvent and going and recovering from this effort. So again, he said, you know, we're all in this together and we're going to get through it. We'll have more on what he talked about coming up on the 5:30 news, but it looks like we are just days away from Montana's phase 2 reopening as we prepare to start welcoming our out-of-state tourists who also bring with them a lot of the money the state needs to recover from this virus. All right, we'll see you back here at 5:30.